What would you say to the families that maybe are going through a problem with a child ADHD? What would you say?
Well, first of all, it's a very treatable problem. Your child can get well and do well. But I think it's really important that you have the child evaluated. Think about whether or not it might be easier for the child to be in school, to be in the community, and at home if he or she could settle down.
Welcome to A Better Life with Pastor Barbara Ann Reese, coming from Faith Life Tabernacle International, 500 Orinoco Avenue in Richmond, Virginia. You have not joined this program by accident, but this is your appointment to receive from the Lord that which you desire. A better life is yours today with Pastor Barbara Ann Reese. This is your day for change.
Let's join Pastor Reese in today's message.
Yeah, I have with me in our studio on A Better Life program, Dr. Foreman. I want to say welcome to A Better Life program. It's wonderful having you here with us. This evening, we're going to cover the topic on ADD and ADHD. Tell us briefly a little about yourself and how you become interested in children.
Well, I completed my medical training at the Medical College of Virginia and then decided to do a residency program in psychiatry. During my time working with adult psychiatric patients, I realized that I really wanted to work with children to try to get in on how to help people earlier so that they wouldn't be so chronically mentally ill as adults. So I did a fellowship in child psychiatry. And I'm currently working at Henrico Mental Health. I've been there for about the past 6 years, and my practice there is exclusively with children.
Would you define for us the difference between ADD and ADHD?
Right. Okay. Well, one thing is, part of it is some old namings. Everyone that I diagnose, I call it ADHD, which stands for Attention Deficit Hyperactivity Disorder. Then there are 3 types of that disorder. There's the predominantly inattentive type, which would be what people used to call ADD. Then there's the predominantly hyperactive impulsive type. Then there's combined type. So people who have inattention and hyperactivity and impulsivity.
That will be the combined.
Right.
Combined. Yes. What are the signs that we should look for in adolescent or adolescent or the children? Are they an early sign or is there a warning sign? Can you share that with us?
Sure. Well, ADHD is a diagnosis, first of all, that you can have across the lifespan. For example, I see some children as early as 3 who are brought to me with the question of whether or not they have ADHD. Of course, at that age, it's a little difficult to determine because children are very active at that age. They are really impulsive. They don't have long attention spans. But often these are children who really are set apart in how their behavior is manifesting even at that age. But then I also see children all the way up through adolescence, but we're also recognizing that a large number of people who have ADHD continue to have symptoms into adulthood. Of course, those symptoms are going to look different across the lifespan, as I mentioned. Early on, with young children, you're going to see, we look for a number of different things. For example, in the inattentive spectrum, we're looking at, does the person have difficulty focusing attention for an appropriate amount of time on a given activity? Does the person try to avoid activities that require extended attention? So, for example, schoolwork and homework. Does the child, seem to get distracted easily by extraneous noise in the classroom or distracted by any other activity that's going on around them? Does the child seem to not listen when spoken to? Does the child not complete tasks? Or if a parent asks a child to go do something and it has more than one command, the child only completes one thing as opposed to 2 and 3 things that were asked. Those are the mostly the inattentive kinds of things. Now for hyperactivity and impulsivity, is the child always on the go, like driven by a motor? Does the child climb inappropriately, or does the parent have a hard time managing the child maybe in a store? The child runs off. Can the child sit still? Does the child have a hard time waiting his or her turn in line? Does the child blurt out answers before the question has been finished? Those sorts of things.
How it affect the children in relationship with their playmates in school? We have a school here, and we have also a learning center, childcare learning center. And how can we know the difference that, it's an episode or it's just a normal, behavior with a child, relationship with their playmates?
Okay. Well, a lot of times children with ADHD, for one thing, don't seem to do very well with peers. They're the children who are deemed too bossy or too rough. They seem to have a hard time. They're getting in arguments a lot of times with their peers. They may be aggressive because if you're impulsive and someone says something you don't like, then you're more likely to blurt out something mean without thinking about the consequences or whether or not that's appropriate, or possibly to get into fights. So in children who do seem to be getting into more arguments, more fights, don't seem to be getting along with peers. Another thing that parents might notice is that the child seems to get along better with younger children, partly because that's socially where their level is, also because those children don't notice that they're as different because they might be functioning more on their level. But they'll notice that children their age don't seem to get along with them as well. In school, I think what would be noticed is that the child stands out as having a shorter attention span, being off task, talking too much, having more problems getting the work done. A child who's jumping up to sharpen his or her pencil or go get something when it would be more appropriate to stay seated. Those are the kinds of things I think you'd initially see.
At what point should the behavior be brought to the parents by the teacher?
Well, for one thing, a lot of children, because if they get into trouble, they might look like they're doing really well some days because they're trying extra hard. Hardly any kids like to be in trouble, so they'll make an extraordinary effort to do well. So there might be a period of the teacher noticing good behavior or parents not getting phone calls or complaints from the teacher, so they think the child is doing fine or that the child can control it, whereas it really isn't reasonable for the child to be expected to work at that level all the time because of the huge effort it takes them to behave properly. So I think that if there are many days or more days than not that the teacher notices that the child seems to have an unusual activity level or an extremely short attention span, that would be a time to speak to a parent, especially if the child's grades seem to be suffering or the child seems to not be enjoying school because he or she has to be spoken to so often. Those kinds of things, because we really worry about self-esteem issues in children with ADHD. Because again, kids don't like to be in trouble.
Dr. Foreman, is this disorder mental or a behavior?
Sort of going way back is that ADHD is probably largely a genetic disorder. We do see that it runs in families. We don't know exactly what the inheritance would be, but we often see it in families, especially from fathers to sons, although that's not strictly true. So we believe that it's a biologic disorder. We're getting more and more understanding that there's a difference in how certain chemicals are, it's hard to know whether how the chemicals are released in the brain or the pathways in the brain are different in children with ADHD. And we could talk about a number of reasons why that might be. But then from that, we don't see a lot of specifically mood problems. We consider it mostly a biologically based disorder that can, of course, have mostly a behavioral manifestation.
Why parents hesitate to seek help?
I think there are a number of factors that play into that. I think we all as parents want to believe that our children are normal and healthy, and we don't want to think that there's a disorder or a problem. So I think that's one thing. I think sometimes parents feel like maybe teachers are judging their children unfairly. They approach it that way, again, because it's hard to say that there's a problem with the child. I think a lot of parents aren't necessarily aware of what ADHD is because, on the one hand, there's some thought that it's overdiagnosed now, that some parents and schools and then doctors really just are very quick to put children on medication, when maybe that isn't the whole issue. Maybe the child needs more discipline or a behavioral contract or those kinds of things, some education. So on the one hand, the disorder can be overdiagnosed, and on the other hand, it can be very much underdiagnosed and underrecognized, particularly in children who have mostly inattention. I think of that as an acting in the sense that the child is inattentive, can't pay attention, sitting there, not focusing, but not really acting up. That child often gets missed. It's just the grades that aren't particularly good. But then the child who acts out, the one who's hyper, who's getting in fights, that child gets noticed more quickly. So the parent might be hearing about that more rapidly. Because of concerns about the medications, I think sometimes parents are very hesitant to seek help for ADHD. And I think that's another thing that keeps them from having the child evaluated.
The effects of depression are staggering. A recent study sponsored by the World Health Organization and the World Bank found major depression to be the leading cause of disability in the U.S. and worldwide. 80% of suicide are carried out by persons who have depressive illness. 15% of people who have significant mood disorder commit suicide. Without effective treatment, the illness can lead to academic failures in our teens. 32 to 40% eventually drop out of school, and only 5 to 10% finish college. Children not able to focus and have classroom behavior problems. Children being neglected by parents who have bipolar depression. Adults with ADHD are more likely to have marital problems and multiple marriages. Even higher incidence of separation and divorce. Today we will be talking about ADHD, bipolar depression disorder. You would hear life stories on how others got their life on track and now have successful, productive life. You are not alone. Call the number that appear on the screen, or you may want to log on fltim.com. When the child is treated, does it help a whole lot? when the child is treated and under medication?
I think it helps tremendously for a number of reasons. One is that the medications themselves can help with about 70% of the children who take the medication, and maybe up to reducing the symptoms by about 70%. That's a lot. Mm-hmm. The second thing is, we know from following children from their childhood into adulthood that if their ADHD is not treated, that they really do poorly. There are a huge number of children, maybe up to 50%, who also have oppositional defiant disorder or conduct disorder, which in adulthood can translate into criminal activity. People who are very poorly socialized, who can't accept authority, so that makes it very hard for them to work. Also, we know that many children with untreated ADHD do not complete school. So that means that their job opportunities are greatly reduced. Then the last thing is that a lot of children who have untreated ADHD go on to become substance abusers. So it's really important that the children are treated so that they stay in school, they don't become involved in criminal activities, that they're able to stay away from substance abuse.
Can you tell us briefly, you diagnose children and you work with children. Can you tell us briefly what is the worst case that you have come across and a child that is being treated, how that child move on in their adulthood life?
Oh, okay. Well, I'll tell you, one of the things that's saddest to me is when I see it, backing up, it's hard to pick a single child who's had the worst outcome, but I can tell you kind of a general thing that happens. I often see children who are in maybe 9th or 10th grade, 15, 16 years old. Some children who have been in the 9th grade, maybe this is the third time. I'm thinking of a particular child. Clearly a bright person, but has so many behavioral problems still based on the ADHD that the child is constantly being suspended so that they can't get along in school. Then the sad thing is that I often then hear from the parent that they've been told throughout the child's school career, and they've seen it at home, really. The child can't sit still for dinner. The child always intrudes on conversations, just many things that they see along the line that the child could have had intervention sooner. It concerns me because I used to also work for the Department of Juvenile Justice, and the number of children that I see who've been sent basically to child prison who have ADHD that wasn't treated, those are the really sad cases to me, because I think that could have been largely prevented. And on the flip side then, I often see children who come in and they're bright, they go ahead, and the problem is that maybe they're not doing as well in school as they ought to, they're getting in some trouble. The parents are noticing that it's hard to get homework done because they really struggle to sit still. But then when you put them on the medication, they respond very favorably. The grades come up. They feel good about themselves. Their peer relationships really improve because now they're not acting goofy or they're not hyperactive and fighting. So many areas of their lives get better. And then they do go on and do much better in school.
What are some of the programs do you offer to the children, for children?
Right. Well, there are a lot of services at Henrico Mental Health. We have a number of treatment teams so that, for example, a child with pure ADHD who is overall doing very well, doesn't have depression or other serious mental disorders like bipolar disorder, those children can come into the clinic and have a brief psychotherapy and an evaluation by me. I'm the psychiatrist there. We can get them started on medication. They can often then have maybe a few sessions with a therapist on social skills and study skills. Parents can be taught some things, and they go on and maybe then have medication prescribed by their primary care doctor. Now, for other children who have more behavior problems, the clinic also has a more long-term treatment team. And that treatment team can provide either once monthly check-ins for case management all the way up to 10 hours of in-home therapy, where a therapist works in the home and in the school with the child and the parents. That's a wonderful service. Then there are adolescent substance abuse services. That's where some of the children who may be self-medicating with alcohol and marijuana, they can come in and be recognized that maybe there's an underlying ADHD. They can be seen there. The clinic is really pretty easy to get into as well. There's an intake number, and a parent could set up an appointment to come in.
Yes. What would you say to the families that are out there? We have an audience here and the viewers. What would you say to the families that maybe are going through the problem with a child with ADHD? What would you say to that parent?
Well, first of all, it's a very treatable problem. Your child can get well and do well. But I think it's really important that you have the child evaluated. Think about whether or not it might be easier for the child to be in school, to be in the community, and at home if he or she could settle down, calm down. I know everyone is hesitant to place a child on medication.
Yes.
Of course, we would prefer that they not have to do it. But if your child can take a medication once a day and be more successful, you have given your child a tremendous gift by having him or her feel better about himself, function better in school, and it really will make a difference in your family life, because a lot of times, you're struggling with your child with getting along with siblings or doing the homework can greatly reduce those problems.
Praise God. That was wonderful and very interesting, because that's a problem that we are faced with.
Sure.
And like I said, we have a school, a daycare, and you see, you want to help children. And so we need to know what to look out for. When should a teacher speak with the parent? Because, you don't want to just go and say, well, your child is not behaving, or we are seeing this type of behavior here. Can they play with their schoolmates? In some cases, like you said, when they're little, it's hard, like a child 3-4 years old, because the average child would fight. You have my toy, I want it. So we have to understand and know when to cry out for help or when to speak with the parents. And I think that you have made some things very clear to us, that when to speak with a parent, when you can say, well, maybe you need to have your child tested, because that's a problem that we are facing with. When should we speak to a parent?
Right. That is a tough position to be in.
It is very tough, because, it's your child. And oftentimes it hurts when a person say, well, your child is doing this and your child is doing that. Every day you're getting negative report. It's very hard. But I want to encourage the parents that are watching right now. There is hope for your child. We care about your family. The earth is made up of families. And there is hope. If you are experiencing your child, whether your child is 3 or 4 years old or a teenager, and you have seen these type of behavior for a very long time, get help. The number is on the screen. We want you to call, get help. Do not stay and think that there is no help. Don't be hopeless. We want to brighten your child's future. Dr. Foreman, can a parent, after a child take the medication and they have been taking it, they can continue and go on with life, and just their life can be pulled and come together, couldn't they?
Sure. And what we find is, I like to think of it as the rule of thirds. About a third of the children will completely outgrow their symptoms. About a third will grow to adulthood with some symptoms, but won't need medication. And approximately a third will go on into adulthood and need medication, but still may function completely normal.
Dr. Foreman, we have a live audience out there, and some of them would like to ask questions. Some of the parents that are here, we have among us educators. We have some parents that are very much interested. And so we're going to take your questions. We're going to take their questions. And so we are open for questions. Dr. Foreman, what type of medication do you describe to a child after you have diagnosed the child?
The primary medications of choice would be the stimulants. That would be Ritalin and Adderall, or the generics for those are methylphenidate and amphetamine salts. Those are the longest used and most studied medications. Now, there's also now a non-stimulant medication for ADHD called Strattera. A lot of parents prefer that because they've heard things that they don't like about stimulant medications. So we do use that. Then for children who don't do well on the stimulants or Strattera, we often have to use things like clonidine or Tenex, which are actually medications for blood pressure. But for some reason, and we're not exactly sure why, it does help children with attention spans and hyperactivity and impulsivity. If those don't work, there are two antidepressants that we sometimes use, either Wellbutrin or Effexor. If that doesn't work, some children have very severely disturbed behavior. We use medications that in higher doses are used for bipolar disorder.
Okay. Is it a certain age that you start giving them this medication? Oh.
Well, we can start using the medications as early as 3. In a 3-year-old, I would tend to use maybe Tenex, one of the blood pressure medications. The methylphenidate or Ritalin and Adderall are FDA approved down to age 6, as is the Strattera. So we can use them in children who are quite young. I also believe there was a question about side effects.
Yes.
The stimulant medications and Strattera have very similar side effect profiles. So we have to look for decrease in appetite or stomach ache, as well as insomnia. Although some children become sleepy, or I've often heard a parent complain that a child seemed like a zombie. That would be when the dose is too high for a child. But then the other thing, sometimes we have to watch out for children becoming agitated or angry, especially when the medication wears off, because we can see some rebound or all that energy that was tamped down by the medication. When the medication's gone, sometimes they really become very active or irritable. If those things happen, then we have to look at a different medication.
The effects of depression are staggering. A recent study sponsored by the World Health Organization and the World Bank found major depression to be the leading cause of disability in the U.S. and worldwide. 80% of suicide are carried out by persons who have depressive illness. 15% of people who have significant mood disorder commit suicide. Without effective treatment, the illness can lead to academic failures in our teens. 32 to 40% eventually drop out of school, and only 5 to 10% finish college. Children not able to focus and have classroom behavior problems. Children being neglected by parents who have bipolar depression. Adults with ADHD are more likely to have marital problems and multiple marriages. even higher incidence of separation and divorce. Today, we will be talking about ADHD, bipolar depression disorder. You would hear life stories on how others got their life on track and now have successful, productive life. You are not alone. Call the number that appear on the screen, or you may want to log on fltim.com. Question: do you use natural medication as well? Any natural, I guess, herbal or anything of that sort?
I don't specifically prescribe them because I haven't seen good studies that indicate that they're very helpful to a broad number of children. However, I know that at Children's Hospital, Dr. Megson will often use things like different vitamins and some herbal things. So if parents are interested in that, Children's Hospital is one of the avenues to go through. I think that some families have thought that dyes in foods and things or food allergies have contributed to the child's behavior. Again, there haven't been good studies indicating that that's true. So I'm not a big proponent of severe dietary restriction. But again, that is something that some families have tried, and some families have found some success with that. But generally, I think that the more mainstream medications have been proven to be more effective.
When a parent notice the behavior in a child, what are the time span that you will allow before you prescribe medication?
Well, ADHD is a clinical diagnosis, so there's no really good testing that we can do. For example, no psychological testing that definitely can rule it in or rule it out. There are no sort of laboratory examinations we can use. So we go by the evaluation, asking the questions of the parents, getting feedback from teachers. At that point, I think we often will try some behavioral techniques. For example, move the child to the front of the classroom in school. Make sure that the teacher either touches the child's desk or touches the child's shoulder to make sure that she or he has the child's attention before asking a question. So using some of those techniques, that's a reasonable thing to do initially. However, again, studies indicate that medication is more effective than behavioral techniques alone. I always believe that you do need both medication and behavioral techniques.
Yes.
So I might see a child and talk to the parents, find out that there's a long-standing problem with the inattention, hyperactivity, and I don't see any other depression or another mental problem that I think better explains what's going on. I may actually prescribe the medication in that first visit. But I also want to add that one of the things I really want to have an understanding of when I see a child is, are we sure there's not a learning disability that explains why the child is acting out in a hyperactive or impulsive way, or is demonstrating inattention? So sometimes we will ask that the parent pursue testing through the schools to rule out learning disabilities as we're trying to identify ADHD.
Yes. All the medication have the same side effects? That's the question that she was asking in a sense.
Well, they all, the most common medications, like I mentioned, the methylphenidate, which is the medicine in Ritalin,
Yes.
the dextroamphetamine salts in Adderall, and the Strattera, they all have similar side effect profiles. But what's interesting is, for example, if methylphenidate doesn't work, Ritalin, maybe Concerta, which also has methylphenidate, might work. But even if those two don't work, then a different one, like Metadate or Ritalin LA, might not have the side effects. If a child seems to be having difficulty with methylphenidate preparations, maybe the Adderall preparations would work just fine. It's really hard to judge until we try it. And I know that one of the frustrations for parents is sometimes it feels like the medications are being changed a great deal. Mm-hmm. And that might seem like the doctor is not sure what's going on, when what could be the case is the doctor has had really good experience with a number of medications and knows that even though they have the same core medication, different preparations might work when another one didn't. So we sometimes do have to try a number before we get it right. I try to tell that to parents from the beginning, that maybe we'll get it right the first time, but that it may take us several tries. The other thing is, if you've gone through a bunch of the stimulant medications and Strattera, and that whole class of medications, they haven't seemed to work well, either because of side effects or they don't seem to cover the symptoms well, that's when we would move into some of the less standard treatments, like the antidepressants or the medications I mentioned that are really for blood pressure.
Yes. So you want to say it's the norm, that parents need to know that this is the norm, that you try various medication until you get the right one for the child. It's not that you don't know what you're doing. It's the right medication for the child.
That's right. And I really tell children that as well, of course, because I want them to know that I will work with them to try to get the right medication, as long as they'll bear with me and let me know when there's a problem.
Yes.
But that I don't want them just to quit and give up.
Yes.
That we might have to work with it for a while.
If you have a prayer report or a testimony of what this program has done for you, or you have received breakthroughs, victories, whatever is your praise report, you may visit us on our web. Let us know and hear about your prayer, your report on what God has done for you. Or you can call it in. Call and let us know. I have a praise report, and this is what God has done for me, because I viewed the program, I watched the program, I've been prayed for, and this is what God has done for me. I would love to have your praise report. So visit us on our web. That's FLTIM.com. God bless you. If a child does not receive medication when they become an adult, does the disorder be worsened? And what will become of that adult? Functioning, I guess, in relationships and in life.
Well, what we hope is, it would be nice if everybody outgrew it, which they don't. Mm-hmm. Now, not treating it as a child won't make the disorder worse as the person gets older. It's just that because the child wasn't treated, the adult may have lower education, may have gone into substance abuse issues because they're really trying to medicate themselves to be calmer. So they might also have problems in jobs because they can't sit still or they can't complete their tasks. So it's really important, I think, to identify the disorder in childhood to make the most for the adult so that they don't lose out on education. And don't also run into those problems I think I mentioned earlier where they might have become sort of more criminal-minded. Since we see that happening with a fair number of children, that's very disturbing.
Yes. What's the history of the disease that has been talked about for so long? What's the history?
That's a really good question, because I think it comes up a lot. Why are we seeing so much of it now?
Yes.
So the question is there a lot more of it, or are we identifying more of it? There are many factors, I think, involved. One is we now live in a society where all children are expected to go to school and sit there all day long. In times past, say 100 years ago, those children might have gone to school the first day and not gone back for the rest of the year. Especially if they lived in a farming community, they might have stayed home and worked on the farm. So they they might not have been identified because they weren't in school. Another thing is, I do believe that there are some societal changes in how we discipline children. I think a lot of children come to school or go out in the community and they haven't really been well disciplined. They haven't been socialized as well as maybe they need to have been. So that's another factor that I think plays into it. As well as we think that things like being exposed to drugs and alcohol during pregnancy can cause ADHD. I think there's probably been more drug abuse and substance abuse in the last 30 to 50 years, so you're going to have more children who are affected. So there are a number of factors about why we're seeing more of the disorder.
With some of the things that the disorder will affect, would there be depression in that as well? Would it affect a child also in low self-esteem?
Well, we often see comorbid or other diagnoses with ADHD. In fact, probably more than half of them have something other than plain ADHD alone. Then the question is, for example, your example, does the child become depressed because of all the negative feedback he or she is getting and doing poorly in school? Or is there a separate diagnosis of depression, a biologic predisposition to the depression? But again, many children have depression, anxiety disorders, of course, learning problems, as well as, I mentioned before, 50% of them have what we call oppositional defiant disorder, or that might later on go into what we call conduct disorder. And those are the children who really have problems with authority and may break the law.
Does stress is a factor in this as well?
I would say that it is. For one thing, I'm wondering if the question really is, does our rapid society with it, where everybody's rushing around, if that's causing the problem? Well, of course, I think that impacts every child. That makes it really hard for all of us to really stay focused and pay attention. So I do think stress does play a role. Does that explain all of it? I don't think so.
Yes. Well, some very interesting questions that you did ask, so everyone do understand and have some knowledge of the disorder, that you can help someone. We want to give hope to the parents that are watching by way of television. And we want to thank you, the audience, for the interesting questions and for coming out. There is hope. Dr. Foreman, there is hope. I want to thank you so much for coming out and explaining to us on the ADHD problem, because, like I said, we have a school here, and it has helped tremendously. And so we want to thank you for coming out on behalf of our church and the Better Life program. It was very interesting, and I know that parents have gotten help. And again, we want to assure the parents that there are different kind of medication that are out there. We don't want you to be afraid of the medication. You need to come and get help. As Dr. Foreman, I'm glad that you explained that, because it can make parents think, well, I don't know. My child has tried this one. How many medication are you going to give my child? And they tend to withdraw. But as you say, it's the norm. You try and let us know if this is not working, and then you try another one until you get the right one. I know someone who is very comfortable with that. They said that they have tried numbers of the medication because they wanted the right one for them. And so now you came and you said the same thing. And I think it will give parents more assurance that it's okay to try more than one medication. Don't withdraw your child because one medication give them some side effects or they don't like how they're feeling with it. But you can come, talk with your doctor, let them know how you feel about it, the side effects and what's going on, and they would give you another one, the one that is right for you. They will give it to you. God bless you, and thanks for watching. I want to extend an invitation to you, all those who are viewing this program right now. You do not know the Lord Jesus Christ as your personal Lord and Savior. I want to invite you and to lead you into a childlike prayer. Very, very simple. Just say, "Oh God, have mercy upon me. Come into my life, Jesus. Wash me in your precious blood. I want Jesus to be my Lord and Savior." The moment you have said that prayer and you really, really mean it from your heart, Jesus Christ has now come to live in you by His Spirit. Now my announcer is going to come and let you know how you can receive a free copy of my book. After you have accepted the Lord Jesus Christ, you need to know what to do. My announcer is going to tell you further what to do.
If you have just prayed the prayer of salvation with Dr. Reese, welcome to the family of God. Your decision to accept Jesus into your heart is the best decision you could have made. We would like to sow a seed into your new life to help your understanding and growth in the Lord. When you contact us, we will send you free of charge the booklet, Now You Are a Child of God. Our contact information is on the screen. Do know that we are rejoicing in your salvation decision and look forward to hearing from you. Contact us today.
Thanks for watching today's telecast. Remember to contact us using the information on your screen. Pastor Barbara Ann Reese and the Faith Life Tabernacle family looks forward to hearing from you. Your life will never be the same. Believe it, receive it, and walk in it.